DARZALEX, daratumumab, mechanism of action.
DARZALEX, daratumumab, is indicated for the treatment of adult patients with multiple myeloma. In combination with lenalidomide and dexamethasone in newly diagnosed patients who are ineligible for autologous stem cell transplant, and in patients with relapsed or refractory multiple myeloma who have received at least one prior therapy, in combination with bortezomib, melphalan, and prednisone in newly diagnosed patients who are ineligible for autologous stem cell transplant, in combination with bortezomib, thalidomide, and dexamethasone in newly diagnosed patients who are eligible for autologous stem cell transplant, in combination with bortezomib and dexamethasone in patients who have received at least one prior therapy, in combination with carfilzomib and dexamethasone in patients with relapsed or refractory multiple myeloma who have received 1 to 3 prior lines of therapy, in combination with pomalidomide and dexamethasone in patients who have received at least 2 prior therapies, including lenalidomide and a proteasome inhibitor, as monotherapy in patients who have received at least 3 prior lines of therapy, including a proteasome inhibitor, PI, and an immunomodulatory agent, or who are double refractory to a PI and an immunomodulatory agent.
CD38 is a transmembrane glycoprotein with multiple functions, such as receptor-mediated adhesion, signaling, and modulation of cyclase and hydrolase activity. CD38 is expressed on hematopoietic cells, other cell types and tissues, and is overexpressed on multiple myeloma cells. DARZALEX is a first-in-class monoclonal antibody that targets CD38. DARZALEX inhibits tumor cell growth through immune-mediated, direct-on-tumor, and immunoregulatory actions. DARZALEX may also have an effect on normal cells. For the remainder of this video, we will discuss the potential effect of DARZALEX on multiple myeloma tumor cells. When DARZALEX binds to CD38 on the surface of myeloma cells, it inhibits the growth of CD38-expressing tumor cells through several immune-mediated mechanisms. These include the initiation of the complement cascade, resulting in complement-dependent cytotoxicity, CDC, by which tumor cells are lysed through recruitment of factors in the serum. The targeting of myeloma cells by effector cells for destruction through antibody-dependent cell-mediated cytotoxicity, ADCC, and the marking of myeloma cells for elimination by macrophages via antibody-dependent cellular phagocytosis, ADCP. DARZALEX also has direct on-tumor action, occurring upon cross-linking and resulting in apoptosis of myeloma cells. DARZALEX also works through immunoregulatory actions. CD38 is found on a subset of immunosuppressive regulatory T cells, Tregs, regulatory B cells, Bregs, and on myeloid-derived suppressor cells, MDSCs, all 3 of which are also implicated in cancer cell immune evasion. DARZALEX specifically decreases CD38-positive Tregs, Bregs, and MDSCs. By combining immune-mediated activity with direct on-tumor and immunoregulatory actions, DARZALEX provides a multifaceted approach to promoting myeloma cell death.
Indications. DARZALEX, daratumumab, is indicated for the treatment of adult patients with multiple myeloma, in combination with lenalidomide and dexamethasone in newly diagnosed patients who are ineligible for autologous stem cell transplant, and in patients with relapsed or refractory multiple myeloma who have received at least one prior therapy, in combination with bortezomib, melphalan, and prednisone in newly diagnosed patients who are ineligible for autologous stem cell transplant, in combination with bortezomib, thalidomide, and dexamethasone in newly diagnosed patients who are eligible for autologous stem cell transplant, in combination with bortezomib and dexamethasone in patients who have received at least one prior therapy, in combination with carfilzomib and dexamethasone in patients with relapsed or refractory multiple myeloma who have received 1 to 3 prior lines of therapy, in combination with pomalidomide and dexamethasone in patients who have received at least 2 prior therapies, including lenalidomide and a proteasome inhibitor. As monotherapy in patients who have received at least 3 prior lines of therapy, including a proteasome inhibitor, PI, and an immunomodulatory agent, or who are double refractory to a PI and an immunomodulatory agent. Important safety information. Contraindications. DARZALEX is contraindicated in patients with a history of severe hypersensitivity, for example, anaphylactic reactions to daratumumab or any of the components of the formulation. Warnings and precautions. Infusion-related reactions. DARZALEX can cause severe and/or serious infusion-related reactions, including anaphylactic reactions. These reactions can be life-threatening, and fatal outcomes have been reported. In clinical trials, monotherapy and combination, N equals 2066, infusion-related reactions occurred in 37% of patients, with the week 1, 16 milligrams per kilogram infusion, 2% with the week 2 infusion, and cumulatively 6% with subsequent infusions. Less than 1% of patients had a grade 3/4 infusion-related reaction at week 2 or subsequent infusions. The median time to onset was 1.5 hours, range 0 to 73 hours. Nearly all reactions occurred during infusion or within 4 hours of completing DARZALEX. Severe reactions have occurred, including bronchospasm, hypoxia, dyspnea, hypertension, tachycardia, headache, laryngeal edema, and pulmonary edema. Signs and symptoms may include respiratory symptoms such as nasal congestion, cough, throat irritation, as well as chills, vomiting, and nausea. Less common symptoms were wheezing, allergic rhinitis, pyrexia, chest discomfort, pruritus, and hypotension. When DARZALEX dosing was interrupted in the setting of ASCT Cassiopeia for a median of 3.75 months, range 2.4 to 6.9 months, upon reinitiation of DARZALEX, the incidence of infusion-related reactions was 11% for the first infusion following ASCT. Infusion-related reactions occurring at reinitiation of DARZALEX following ASCT were consistent in terms of symptoms and severity, grade 3 or 4, less than 1%, with those reported in previous studies at week 2 or subsequent infusions. In Aculeus, patients receiving combination treatment, N equals 97, were administered the first 16 milligrams per kilogram dose at week 1, split over 2 days, as in 8 milligrams per kilogram on day 1 and day 2, respectively. The incidence of any grade infusion-related reactions was 42%, with 36% of patients experiencing infusion-related reactions on day 1 of week 1, 4% on day 2 of week 1, and 8% with subsequent infusions. Pre-medicate patients with antihistamines, antipyretics, and corticosteroids. Frequently monitor patients during the entire infusion. Interrupt DARZALEX infusion for reactions of any severity and institute medical management as needed. Permanently discontinue DARZALEX therapy if an anaphylactic reaction or life-threatening grade 4 reaction occurs, and institute appropriate emergency care. For patients with grade 1, 2, or 3 reactions, reduce the infusion rate when restarting the infusion. To reduce the risk of delayed infusion-related reactions, administer oral corticosteroids to all patients following DARZALEX infusions. Patients with a history of chronic obstructive pulmonary disease may require additional post-infusion medications to manage respiratory complications. Consider prescribing short and long-acting bronchodilators and inhaled corticosteroids for patients with chronic obstructive pulmonary disease. Interference with serological testing. Daratumumab binds to CD38 on red blood cells, RBCs, and results in a positive indirect antiglobulin test, indirect Coombs test. daratumumab-mediated positive indirect antiglobulin test may persist for up to 6 months after the last daratumumab infusion. Daratumumab bound to RBCs masks detection of antibodies to minor antigens in the patient's serum. The determination of a patient's ABO and Rh blood type is not impacted. Notify blood transfusion centers of this interference with serological testing and inform blood banks that a patient has received DARZALEX. Type and screen patients prior to starting DARZALEX. Neutropenia and Thrombocytopenia. DARZALEX may increase neutropenia and thrombocytopenia induced by background therapy. Monitor complete blood cell counts periodically during treatment according to manufacturer's prescribing information for background therapies. Monitor patients with neutropenia for signs of infection. Consider withholding DARZALEX until recovery of neutrophils or for recovery of platelets. Interference with determination of complete response. Daratumumab is a human immunoglobulin G IgG kappa monoclonal antibody that can be detected on both the serum protein electrophoresis SPE and immunofixation IFE assays used for the clinical monitoring of endogenous M protein. This interference can impact the determination of complete response and of disease progression in some patients with IgG kappa myeloma protein. Embryo-fetal toxicity. Based on the mechanism of action, DARZALEX can cause fetal harm when administered to a pregnant woman. DARZALEX may cause depletion of fetal immune cells and decreased bone density. Advise pregnant women of the potential risk to a fetus. Advise females with reproductive potential to use effective contraception during treatment with DARZALEX and for 3 months after the last dose. The combination of DARZALEX with lenalidomide, pomalidomide, or thalidomide is contraindicated in pregnant women because lenalidomide, pomalidomide, and thalidomide may cause birth defects and death of the unborn child. Refer to the lenalidomide, pomalidomide, or thalidomide prescribing information on use during pregnancy. Adverse reactions. The most frequently reported adverse reactions, incidence greater than or equal to 20%, were upper respiratory infection, neutropenia, infusion-related reactions, thrombocytopenia, diarrhea, constipation, anemia, peripheral sensory neuropathy, fatigue, peripheral edema, nausea, cough, pyrexia, dyspnea, and asthenia. The most common hematologic laboratory abnormalities, greater than or equal to 40% with DARZALEX, are neutropenia, lymphopenia, thrombocytopenia, leukopenia, and anemia. Please see the full prescribing information for DARZALEX available at darzalexhcp.com.